Hi there, and welcome to UEA Mental Health Nursing. I'm here with Gill today, and I'm really excited to find out a bit more about Gill. I suppose what I've been doing when I've been speaking to all the mental health lecturers is just, I'm really interested in when was that first I want to be a mental health nurse. And we were talking before I pressed record, and you've got an interesting sort of route into it. So yeah, when was that first I want to be a mental health nurse?
I fell into it really. When I had my last child, I've got 4 children. When I had my last child, I thought I wanted a little job of convenience that would work around the kids. And so I got a little job as an HCA round at one of the local hospitals, an NHS-run hospital, and it was for continuing care patients, so mainly dementia patients. Okay. And so I worked there for about 4 or 5 years. In between that, I was doing a little bit of training in admin work. I was working for the same trust, doing some bank work in admin, but also continuing with my healthcare assistant banking. And they asked me at the time, I was really, really lucky at the time, that even as a bank care worker, I was offered the opportunity to be seconded. So they seconded me to do my nurse training. So I'd done an access course, and that was my route into university.
Was the secondment, was there like a practical element, whereas it hadn't been theoretically possible for you to sort of pursue a nursing career?
I wouldn't have afforded it at the time. I wouldn't have been able to afford it. And at the time I did mine, they were still doing diplomas, so you could get a bursary. But I still felt it would have been, especially in terms of the commitment that you have to give to the course. I don't think I'd have been able to afford to work and do the course. I would have found that quite, especially with a family too. Yeah. Because it is quite. Hard work, you've got to be committed, you've got to put the time in. And to do that and work, I know that I would have found that tricky. So for me, being seconded and being paid to do my training, I was very, very lucky. And I know I was lucky.
It's very similar to where I was. I think, I'm not even sure, well, I knew nurses existed, but it wasn't something that I thought about purely because I didn't think I could practically do it. And like you say, I do know how lucky I am that happened. So it sounds to me like there was a practical element, but that you also had been doing some work associated with healthcare that must have created was there a point where you thought, oh, I can do this, I'm quite good at this?
Yeah, definitely. I just thought it was such a rewarding job. I loved working with older people. I thought that when I finished my training, that was absolutely where I wanted to go and work. I had it in my head all the way along, doing my training. I was going to work with older people. I had a place ready for me when I finished, to go back there. But things changed during the course.
And I know what the change was, but what was, and where you eventually went, but I suppose what was that? Because I had a similar point, but actually probably in the reverse. Look, where was the point where you went, oh, I like this, but actually I really like this, and this is where I'm going to go with my career? It
was in my last year.
Okay.
I mean, in my last year, I'd had 2 amazing placements. Both of which that I was lucky enough to go back and work at. So when I qualified, I went back to where I'd been seconded from, the continuing care ward. However, it was ward work. And the one thing that I did get from doing all my placements on the course was that I wasn't sure that ward work was for me.
Oh, that's interesting.
I liked, working in the community. I liked community work.
I'm going to be that annoying person now that asks why.
Why?
Because when I've been recording these, Jane said the exact opposite, and I think that's really fascinating. That you sort of, there's a point where you go, this suits me, and I'm just interested about the kind of like, was it the placement experience, or was there something in you where you thought, I'm more suited to a community?
I definitely do think that. I think the placement experience was part of it. I think I was lucky enough to go to some fantastic teams, and I mean they were really good. The teamwork was really good. They had a good ethos around teamwork. And that really made a difference for me. So whereas you might think you're working very in an isolated way, or you're working autonomously, yes, of course you are, but some people might think that working in the community you're quite isolated. If you've got a good team, you don't feel isolated.
That's true. You sort of. I remember having this discussion, and I was like, I don't actually in a community team. Yes, I'm driving, and I'm usually on my own. And yes, for the appointment, I'm on my own, and I drive back, and I'm on my own. But the rest of it was really involved in the team. Yeah,
and I think it's really important. I think that's the bit about working in the community. It's important to have that because you are doing all that individual work. So it's really important that you've got a good, strong team behind you when you come back, or even when you're out. You want to know that there's somebody back there you can call if you need to ask advice, and there always was. I could be out doing a risk assessment at the hospital. If I wasn't sure about something, I could always call back in, speak to somebody at work, run it by them, kind of talk things through, and that's a good team.
So you've said a good team and a strong team. I don't know if I'm sort of pouncing this question on you, but what do you think it was about the teams that are working well? What characteristics do they have?
Okay, the only way that I can really think about it is having been in the same team where things changed, and when things changed and you could see that priorities were changing. So I'm being a bit cryptic here, I'm sorry.
No, I'm sure you're being, you're considering what you're saying. That's very appropriate.
So things changed and our priorities had to change for a little while. And I think, we got to a point where we were really firefighting, if that makes sense. We were working we had a long waiting list, and I think the powers that be above wanted us to make sure that the waiting list came down. So it was kind of, we want you to do this, and we wanted you to do it this way. And I think management is important. So if you've got a good manager who is democratic, will work with the team, will make decisions when they need to. However, there was a real collaborative sense with our manager at the time, who we had several managers actually, and the one that stepped in and kind of said, hold on, we need to just think different. We need to step back a bit and think about what we can do to make things better, because when you're firefighting, you don't get time to reflect, you don't get time to think about what you could do differently. And she gave us that time. She just kind of said, hang on, the waiting lists are going to be there. If we don't do something differently, it's not going to change. And so she really encouraged us to develop within the service. And I think, there was that, you really saw change happening. So we developed groups, which I was a big part of. That's part of my passion really, is group working as well. And so we developed groups, and we managed to, over the course of a few months, probably about 8 months, we managed to pull it back, drop our waiting times, you know, and just work differently, work smarter, you know. And I think the thing was having that team that pulled together to do that. So you could quite easily have lost people from the team if you didn't look after each other. Especially in that firefighting period, I think people were under stress, and I think it was the you know, I just think it was the ethos that the team had about looking after each other, respecting each other, having compassion. It was just the way we looked after each other. I think that was...
It seems from talking to people this morning, it's reflection on oneself, on personal reflection is coming up time and time again. Part of nursing, you can't really be an effective nurse and manage the challenges of nursing and progress unless you reflect on yourself. But I think what you're talking about as well is there's, especially that manager, is a kind of almost a team reflection. And when you're caught in firefighting, you're less able to just take that moment where you reflect. And when I say reflect, it's kind of like, let's be honest about what the real challenges here are, and once we've identified those, how we're going to move on. And it sounds to me like that really was leadership, you know, that kind of like, it's not, we're going to do this, and when we sort of like say we're going to do this but we haven't really taken the time to think about it, then that's not true sort of reflection. That's quite interesting. I want to go back to you. So there was something around groups there, and I know that you took a therapy pathway as well. Could you tell us a bit more about those career choices? Was it something that sort of fell into your lap, or something you were sort of like, you felt, oh, I'm good at this, therefore I'm going to do it?
I was just, I mean, I will still go back. I mean, I know the trust that I worked for, you know, sometimes was in the press quite a lot, but I cannot say enough about the opportunities that they gave me. And they really did, you know. I went from, so when I qualified, like I said, I went back to the older people's ward. I then went on to working in the community with adults. But the other part that was still kind of stuck there for me was when I'd done the placement in child and adolescent mental health. And I loved it. I never wanted to do it. One of the things that I'd stated when we started the course was, I don't want to do CAMS.
Really?
I don't want to go to CAMS. Just because I had children, I was worried about how it might affect me emotionally. However, it changed me completely. It's what I knew, it's what I wanted to do. And I went back there. I managed, luckily enough, I got a job there. And the opportunities just in terms of in-house training were amazing. So they ran a family therapy team, and they ran 2 family therapy teams, one for you know, kind of general generic cases, but also they had a family therapy team associated with looked after and adopted children. So they would work with birth parents, adoptive parents, foster parents, you know. And so I was part of that team for a year. And that was amazing. It taught me, I don't think anyone shouldn't get that kind of training when they go, they should all have that training when they go into CAMS, because it is a fundamental aspect, working within a family, working within systems. So I loved that. And after, because you were only got a year in there, actually we should have only had 6 months, but I managed to wangle a year. And coming out of that, I then went into another team where we worked with, same team, but another team within the team, who worked with, so it was like a psychotherapy group for children and young people, with an age group of 15 to 18-year-olds. and we kind of used a similar, so we used a screen, so it was a bit unorthodox.
Okay, yeah.
But again, this was the psychologist kind of thinking outside the box and doing things differently. So I was in there for a year, and I absolutely loved just the dynamics. So what you learn from dynamics and what you can feed back, and you kind of feed the information back that you have observed to the family or to the young people, and it's just watching them digest that.
Okay.
And just seeing the difference it makes to them. So they're then reflecting on things, and it's because what you're doing is you are reflecting on the dynamics that are happening in the room.
Okay.
And one thing about working in groups is that you learn so much about yourself. Like you say, you learn a lot about yourself, don't you? And that's something that you could actually see. It was almost tangible that you could see this happening with young people. You could definitely see it with families, but working with young people. And so I wanted to do a bit more in group work. So again, my team or my manager was happy to fund for me to go to the Tavistock and do a 2-year postgrad in group work. So just thinking about working in systems, working with groups, small groups, big groups, and that was an amazing experience. Weird at times, but amazing.
I definitely got that. I think it's really important to acknowledge how much, but we had the same employer, and they were incredibly supportive of development. It blows my mind how well supported I was to progress my interests and sort of formalise them into training and those sorts of things. And you're speaking about, it's really nice as you're speaking, I'm sort of almost having this proxy sense of satisfaction as you're speaking. I was like, yeah, that's really rewarding when you're talking about the effect on the family and sort of tangibly seeing that, although perhaps it's slightly sensitive and it's not comfortable to share. Seeing that it's actually having an impact is really rewarding.
Yeah.
What perhaps were some of the more challenging aspects of your role, and how did you manage those?
Well, pretty much what you're talking about there is that sometimes it can be uncomfortable, especially when you're working with parents. I loved working with parents. I liked working with young people, but actually I really liked working with parents. And sometimes those conversations could be really uncomfortable, really challenging, and sometimes to the point where a bit scary, because you are having to draw attention to certain behaviours that are having a detrimental effect on their children.
And that's a really, if I think of the times perhaps that someone's commented on my parenting, it's a real, I can sort of feel how I might react to that.
So you have to be quite skilled at doing that, and it is a skill, I think. You can't come in and criticise somebody's parenting without knowing where that's come from. Why that's happening. And so part of that from the family therapy team is kind of part of that is looking at about their own, the parents' own background. Where does that come from? Talk about family scripts and the scripts that get rewritten in families, and so it was sometimes difficult to have those initial conversations. I'm not saying that every single time it works out the way you want it to or you anticipate it working. But, quite often you could see a difference. And even if it's only a small difference, it's a difference. But they're the times when it did become challenging, when you would be working you know, I would say 90 to 95% of the time you would have, you know, a good outcome in terms of a change. May not be a massive change, but a small change.
Do you think there's been a change in you as a person from being a nurse?
Oh God, yeah, absolutely. Very much so. I look back at myself, and I just, yeah, I think I am definitely not the same person I was.
It's really interesting. I hadn't intended to ask that question of everyone I've spoken to this morning, but it's been really clear to me as I've been speaking that nursing has sort of almost become not necessarily a part of your identity, but like it's this process of reflection. We often, especially mental health nursing as well, I think, because it's about humans and how you're dealing with humans. And you talked there about you didn't really know the answer until you traced back the family history, but also that person's history, and then you had a kind of context for where they were in their journey.
Yeah. And I think, you know, I know I've seen a bit of Jane's film, and you know, and I think it is about you. I think when you come into nursing, you might not know it when you first start your training, but you have got to look after yourself first. So, you know, I had a difficult childhood, and that's probably why I was like I was before I did my training. However, you know, you go into this role and you are looking after other people. And it's that old adage, isn't it? You know, the mask in the aeroplane. You put the mask on yourself before you try and put it on your child. You must look after yourself first before you look after somebody else. You can't do it if you're not feeling resilient enough.
100%.
And you need to get the support. But you know, I think I had a. I think it was especially in CAMS. I just realised that actually, you know, I wasn't that, you know, things weren't that bad actually. I could manage things. I was resilient, and you know, I could understand why I'd maybe felt like I had, and why I maybe did things I did. But yeah, but I think it's not the place for me to therapy myself, if you like, coming into this role. It was about me reflecting, just thinking about things, just being able to reflect, and about acceptance, and just accept that, you know, okay, things were pretty bad at one time. I'm okay. I'm resilient enough. I've learnt ways to manage things, and and I could go on and help others.
Maybe it's not specific. You know, I was about to say that mental health nursing is highly likely to change you as a person because it is a process of reflection and those sorts of things. But maybe it's just work. I don't know. Maybe if I speak to other people in other roles, there's that similar relationship between the demands of work and how we adapt to those demands, or don't. But like you've described how you did adapt to those, and how we sort of grow as a sort of person alongside that.
Yeah.
Whilst also Ros was talking about maintaining that boundary between private life and work as well.
I think that's hugely important. You know, I would work with young people and I would think, I can really relate to how you're feeling, but it's not something that I would you know, kind of express why I can relate to how you're feeling. But at least I could maybe say, you know, things like, it sounds really difficult, or it's really understandable why you know, this is what you've gone through. It's really understandable that you might be feeling like this. Now, I'm not saying that I needed to have gone through what I went through to be able to say that, but I did have a genuine, authentic empathy for them, you know. But boundaries so important.
And also, was that challenging then? So when something sort of pushed those buttons from stuff in your actual life that you know, someone said the thing that you've gone, I've been through that. Was that challenging, or was it almost rewarding that you could relate?
Do you know, I think it could have been more challenging had I not had a good team.
Okay.
I got great supervision.
Mm-hmm.
My clinical supervision was, you know, I had a clinical supervisor that, you know, knew some of the things, knew things that might trigger things for me, so
Okay.
kind of bereavement and things like
Okay.
that. And you know, so I could talk openly
Okay.
about it, you
Yeah.
know, and you know, it was fine, you know. I managed it. I never went home, you know, kind of being triggered and not being able to go back to work or do my job. It was you know, I could manage it. It was never that hard.
Yeah.
Yeah.
Okay.
I don't mean to have over-dramatised it, but it was never that difficult. But I think that's something that you need to be aware of when you do your training, is that you're going to go into placements and you are going to feel like, oh, this resonates quite a lot with me. And you might notice, you might come home from a shift and feel just overwhelmed and not even realise why you're feeling like that. And it might be that something's unconsciously triggered something in the background, but it's just being aware. I think it's learning to be self-aware and understand what those things might mean to you.
No, it's incredible. And definitely from these conversations this morning with different lecturers, what's clear to me is that nursing, perhaps mental health nursing, in particular, the level of reflection is sort of quite mind-blowing, really. The sort of processes that, you know, it's almost like it's second nature to you, but there's a huge process that you've been through of this sort of reflection and adaptation, how you've managed that as well when it's been a bit sort of raw. Okay. Well, thank you. Again, I feel a bit humbled that there's so much of what you said is kind of like the first time I've heard it, and I feel like I should have known that already. But I really hope that was useful to people that are listening to this, to sort of know a bit more about you. I found it useful, so thank you.
Thank you, Jason.